Hey there, my name is Justin Jacobs. I am the owner and principal agent of Health Plan Markets. So today what we're going to do is an overview of our agency, all the tools and resources that you get for joining HPM. So let's dive in. So my experience, I started back in 2005. My start was a little unique. I began my career working for a group of physicians, and it was my job to go out there and brag about how good our doctors were. And if I did a good job, a patient would say, hey, how do I join your practices? And so the best way to do that is by joining an insurance plan. And at that time, I was marketing Medicare Advantage. And so then I would go ahead and send that business, that new patient, to an agent to enroll into our practices. Well, I got pretty good at it and made a lot of good friends, a lot of insurance agent friends. And one day, my insurance agent friend showed me his paycheck. And I said, wow, I think I might be interested in doing that side of the business. So then I made the jump and began my career as a broker. Now, back in 2005 in Central Florida, there wasn't a lot of health plans out there. And so... and there wasn't a lot of support. There was no agencies at that time that dealt with independent agents like they do today. And so I saw a huge gap. So my career actually started in the back of my car. I collected all the health plan documents and drove from home to home to home to help patients find the best health plan for them and find the doctors that they needed in order to improve their health care. Now, fast forward, we are a full-service FMO agency that focuses only on healthcare services, but there's a lot of things that make us special. So what I want to do today is share a quick video that kind of gives you an insight of our culture. Please enjoy.
How has Health Plan Markets, HPM, helped me to become a better agent? Where can I start?
So from an agent's perspective, the reason that we started HPM, we looked at the market and we realized that there were so many agents out there that weren't getting the services that they needed.
Being a captive agent, it was a great experience, but I feel that becoming an agent with HPM has enhanced my career.
Most agents have to build their own system. And most agents out there, they didn't have a system.
Oftentimes, I think I felt like I was on an island all by myself.
It wasn't the income and flexibility that I was looking for.
So we decided to create something to meet those needs.
HPM has helped me become a better agent because now I have a better network to work with.
The one-on-one training and the tools and things that they offer.
How to keep ourselves organized and on task, training, development, a lot of things for us.
I also have more resources as well.
It's given me a lot of tools, marketing, putting me in the right position to succeed.
You don't get those anywhere else.
But now as an independent agent, it's just a whole new world that's being opened up to me.
So you have to be very organized and you have to have a lot of resources.
Some of the tools and perks that I enjoy of being here is the monthly dinners that we have for the top agents.
Last year we took a wonderful cruise to the Bahamas. That was a great time, again, with some of my colleagues that I worked with.
My cruise last year was fun.
The other perk that I really do enjoy is the CRM. It reminds me every day of a birthday that's coming up so I can call the member or send them a card. The other part that I really enjoyed is having the team that Justin has here.
The perks I really like, just the environment, the culture is healthy. We have 2 offices that we can go to and get things accomplished and get things done.
You're not just an agent, your family, you work so closely together.
Here we want to help each other.
You become friends and then friends become family.
Becoming an agent with HPM has enhanced my career. I see a brighter future now at the end.
Someone that's looking for an agency, I would definitely say to them, whether they choose Health Plan Markets or another agency, I would really look for a true partnership, somebody that's going to support you in all sorts of ways and help you train and get to the next level.
Health Plan Markets.
Be independent,
but not on your own.
So there you have it. This is hopefully gives you a little bit of insight about our culture. And as you saw in the video, be independent but not on your own is not just our theme, it's what we live by. We do not have a captive program. We do not compete with agents out there on captives. However, being a captive back in the day, I realized that the level of support a captive agent gets on a captive gig makes it very attractive for you to stay there. And so we got that. And so we understand that, if we can deliver the same level of support that a captive agent gets, but still allowing you to be independent, running your own business, but having that support on the other side of it is really going to help you take and get to the next level. So here's a little bit about our recipe here, and we're not afraid to share this with you because I think that this really sets us apart. First things first, when you first come into Health Plan Markets or one of our partner agencies, you're going to realize that you're going to have a personalized agent experience. We understand that not every agent is coming into Health Plan Markets at the same level. You may be just getting started in the insurance industry, or you've been in the industry for 25 years. So you can't have the same conversations or build the same marketing strategies with somebody that's been in the business for 5 minutes than you can with somebody that's been in it for 5 years. So we understand that, and we personalize that experience to help you grow your book of business. The second part of this is technology. So you'll see in the tools and resources that we have, technology keeps you bleeding edge, keeping you ahead of your competition, but it also helps you stay organized, and that's the most important part that you saw in the video, where most agents don't really have a lot of systems out there because they're A, expensive, or B, complex. So we want to simplify that and make your life easier by bringing technology that's easy to use so you can enhance your career. The third part is the helpful team culture, and this is very hard to portray in a video. Easy to say, but not easy to deliver. But I will tell you, at any point in time, you can call our office, and we have several people where we're going to introduce you today, where where you can get your help from. At the end of the day, none of this matters unless you have results. So this is a results-driven partnership. We understand that without your success, we do not have success either. So we must make sure that we're delivering results in order for this to make sense for both of us. And of course, appreciation. It goes without saying, appreciation goes a long way, especially for all of the hard work that you do out there servicing your customers and prospects. This is our locations. We are now currently in 28 states across the United States. Why does that matter to you? Well, maybe we're talking to you in Florida, but one of your clients moves to Georgia. Well, traditionally, you'd have to go ahead and let that client go or connect them with an agent in their new market. But we can actually compensate you in other states. The other reason why this might be important is with our new HPM Shop enrollment software, you're able to do business literally anywhere in the country. So you're not just stuck in your fishbowl, maybe in Ohio, and so it's so competitive out there in Ohio that maybe you want to expand into Pennsylvania or New York or Kentucky, where competition might be a little bit less. You can do that with our tools and resources, and we're already there and licensed, so it makes a lot of sense. We have 2 office locations, retail locations that we use for agents to come in, and most importantly, clients. So this is our main location in Orlando. Clients can come on in and get their questions answered and find a health plan. But most importantly, we use these hubs as customer service. So many seniors are confused by all the mail that they get, phone calls that they get, and they know they can come into our office and get true, honest answers on what's going on with their health care. And we're happy to go through their mail with them, even if it's advertisements and marketing, like most of it is. So we do have our West Colonial office and also Jacksonville on the north side, just south of the airport there, for folks to come in and get service. So I'm not alone. Thank goodness for that. I have an incredible team at Health Plan Markets, and I want to introduce you to a few of them. So Tom Ryan came over from a health plan. He was a broker manager. He is now our coach and advisor. So if you get stuck on a subject, you're not quite grasping low-income subsidy, or you need help understanding Medicaid, this is the guy that you turn to. We have John Minotti. He's our IT manager. So although you're independent, you don't have to live at Best Buy getting Geek Squad if your computer goes down. John is here to help you with your email, CRM system, our Google integrations, and our brand new HPM Shop quote and enroll tool, as well as Health Sherpa. So if you have any questions regarding IT, we have somebody on staff ready to help you. We have two incredible advisor support folks, Kim Rivers, who's been with us for about 3 years, and Samantha Diaz, who is bilingual. Both of these ladies, every year, one of their main objectives is to call books of business, check on clients, and then if necessary, set an in-home person, which now we're doing a lot more virtual, where you as the agent are able to connect back with your client. This gives you a level of support that is expensive if you went out and hired an assistant, but also gives you this clout with your clients that now you have a virtual assistant. And these girls do such a great job, taking notes and ensuring that your clients are happy. And if they're not happy, we get them back out in front of you. And one of the greatest tools that we have linked in with John is we have the ability to go ahead and set the appointment for you and put it right into your calendar. So this is really, really great support. They're also there to proactively call you and check on you and make sure that, hey, did you know about this training? Or do you have enough kits? Or do you need a doctor to work, which we're going to get to in a minute? Or do you have enough marketing? What's going on with you? We want to check to make sure how do we help you get to the next level. So that's both Sam and Kim's role at the organization. Jumping over to Cindy. Cindy helps with administration. She's also the lovely and has a beautiful accent when you first answer the phone. She is wonderful. She's our first line there when you come into the office as well on West Colonial. Cindy's amazing, and she's there to support all of our roles at Health Plan Markets. We recently brought in Ron Landeras for folks that have their own agency. Ron, very similar to Kim and Sam, proactively reach out to our agency partnerships and check in with those agency owners and say, hey, what does your team need? Do you need training? Do you need kits? Do you need marketing? Do you need doctors to work? We're here to support you, and we're here to deliver those resources. So that's Ron's role. We also have Casey Asdot, who helps us with our social media. She also assists Sergio with his marketing, and we're going to talk about his role because that's very deep with Health Plan Markets. But Casey reaches out and does posts and help us generate leads online. Jessica, this is our linchpin here. Jessica does a phenomenal job with contracting, licensing, certification, compliance, and recertification every year. So right now it's the end of July, so we've got quite a few individuals that are recertifying for their 2022, and Jessica is there to ensure that they understand what they're doing. Jessica's also the first stop when you come on board with Health Plan Markets, because you need to know how to get aligned. If you need a contract, she's going to walk you through that process on getting RTS, what we call ready to sell, with each and every carrier. Victor Crumity is our sales manager for our direct team. Those folks that choose to join Health Plan Markets Direct, Victor is there to support you proactively in the field. So if you get yourself into a selling situation and you're really not sure, what do I do in this situation? Or, hey, Victor, can you help me with a tabletop? Or I need a little bit of extra coaching. He also does shadows to ensure that you're doing everything properly and, making sure that you're able to close sales and bring home the bacon is what we like to say. So Victor is there to support you on the daily. Victor, Nick, and Ron all report to Sergio Diaz. He's our Vice President of Sales and Marketing, and he's in charge of everything and anything marketing and advertising. So if you are looking to set up events, or maybe you need a strategy to get things going, Sergio's your guy. He's the one that's going to meet with you and figure out what you're good at and what type of marketing strategies work best for you. Last but not least is our Director of Provider Relationships, and business development, Mr. Nick Street. Nick is in charge of going out and finding physicians for us to work with. It is his job to build and maintain relationships with not only primary care physicians, but their larger organizations, MSOs and IPAs, which are the managed service organizations or the independent physician associations as well. And I'm sorry, managed service organizations are both of those organizations that work together cohesively with doctors and build out groups. So Nick's in charge of assigning agents to doctors' offices. So that might be one of the reasons why you've chosen to be here today to learn more about how we can help you connect with doctors. This is a list of the majority of our carrier partners. However, since this recording, we seem to have added about 3 or 4 new ones, so we're always updating this slide. But as you can see, we have all of the major players in most markets across the country where we do business in those 28 states. No, we don't have every single health plan, but for the most part, we've picked key players in each market to really help grow the business and deliver on helping our community connect with quality healthcare. Wrong way. Okay, here we go. So what are most agents missing? And this is the magic question here. And you might be asking yourself this on the daily these days. This is what we've discovered out there. Most agents are obviously missing support. They feel like they're on their own. We have, as you can see, we have an incredible team that's going to deliver not reactive support, but proactive support. And that's really important when delivering the type of service that your members expect from you. Obviously, leads is a big thing too. You might not be generating enough leads. We can teach you and we can help you generate leads, not just offline, but online and through community events and doctors. Most agents are missing a place to call home, and an agency should be those things. However, we find that there's a lot of agencies out there that are not treating agents as if that they're their home, and I think that's obviously the wrong way to go about it. Technology. We've got a lot of technology to not only track your enrollments, save your client interactions, but automate some tasks to make your life a lot easier, and we're going to talk a little bit about that today as well. Personalized marketing. Many carriers have flyers and postcards and business cards and things like that are out there, but they might be focused on that brand and not so much you. And we feel that if you're out there doing all of this work and the community knows you are the value add into this mix, and you should be front and center in all of your marketing. And then lastly, systems and organizations. As I mentioned before, most agents don't have systems and organizations because they're extremely expensive. So what we've done is invest in those systems and organizations to ensure that you have state-of-the-art software and machinery in order to stay competitive and focus on customer service, answering your phone, taking care of your clients, and of course prospecting to grow your book of business as well. So the solution, what we've designed here is a home where you have all the tools and the support that you need to become a well-rounded, successful benefit advisor. So what makes us unique? Hopefully we've covered a little bit about that today. However, we've got some tools and resources that we have invested in to really make your job amazing. Now the first thing is our HPM Shop. This is our quote and enroll tool for Medicare Advantage plans. This thing connects directly to Medicare.gov. Why is that important? Well, Medicare.gov has all of your clients' information, their primary care doctor, their Medicare number. If they have extra help, it tells you what level they have. And it has all of their medications with the correct milligram dosages that they've had in the last 18 months. So this enrollment software is able to connect to their Medicare.gov account. You can help them set it up, and it pulls down 18 months of what we call adjudicated medications. These are medications that have been filled by your members, and now they're coming through and they live on your platform forever and always. So every year when you check with your members, you have all of this information living in that enrollment software that you can pull up year over year. You can, with this software, you can obviously email them side-by-side quotes. This is CMS approved software, and we get it approved every year. We are now in the process of approving the next plan year. But you're able to quote and enroll your clients remotely. You have your own personal URL. You're able to text message scope of appointment and the application directly to your member. And if they have a smartphone, which most of them do, if you have a smartphone, they can go ahead, log in, and sign their application right from their phone. So there's no need to meet your clients during open enrollment, which hopefully helps you become more efficient. So this incredible tool really helps streamline the process of quoting and enrolling and helping them with transparency so they can see exactly what plan is going to be best for them. Our training calendar. I have a saying, you always have to have one foot in the classroom and the other one in the field at all times. Training is massive. It doesn't matter if you've been in this business for 5 minutes or 5 years, you must continue to do training. But there's a lot of trainings going on, so you might miss some things. What we've done is compiled all of the trainings that we do internally and with our carrier partners, along with our providers and doctors, and we organize it in one calendar so you can see exactly what's going on for the week. These training sessions are either virtual or in person. So if you prefer to meet in person with these training sessions, a lot of them still are. Others you can go ahead and jump on virtually. And this thing syncs to not only your laptop, but your phone and your iPad if you choose to do so. We have built a personal website for you, so you have the opportunity to get a free landing page, and we will be generating leads on Facebook, through postcards, letters, to drive business to your personal website where your members can quote and enroll themselves on your personal URL. So this gives you the ability to market your own website. They can read about you and they can sign up and get set up on your personal agent website. And the best part is you get full credit. You get full commission for using this agent website. There is no charge for using any of these tools or resources that I'm mentioning here today. Customer relation management. This is the brains, the heart and soul of your operation. This is where you take care of your customers. I like to call it your client headquarters. This is where you're going to keep all of your client data, all of the interactions that you have. So if you had a phone call, you can go ahead and mark that you had a phone call with Mrs. Jones and you talked about, the cats that she has and she's having a problem getting her medications. So these are interactions that you can track. It's accessible 24 hours a day, 7 days a week from your devices, whatever you set up. And we have some fully automated communications that happen right in the system. So when you do an enrollment and you plug it into your CRM system, it automatically sends out thank you letters, thank you emails, and tasks and reminders for you to call your members maybe on day 10, day 30, day 60, day 90, in order for you to maintain that relationship, especially coming out of the gate after the enrollment process. One thing that we've learned is there are many agents out there that run and gun, that sign up clients and they never talk to them again. And our number one lead source at Health Plan Markets is client referrals. And the reason our client referrals is number one is because our agents have exceptional relationships with their clients and deliver proactive support. And the only way to really do that is by having a system like your CRM. It's very difficult to do it manually, so we give you the CRM system on your own. Now, this is great. It actually fits me right into the picture here. The CRM system, first and foremost, when we do our marketing, it runs campaigns and it captures leads and creates these lead profiles in a database. It then automatically round robins a lot of these leads for conversion. So As part of the CRM round robin system, if we have a lead campaign with a postcard or maybe a Facebook ad, when someone clicks and fills out that form, we round robin those leads and you are notified, and so you can follow up and enroll that individual. Sales is the 1% of that relationship, so once you do the enrollment, that's really where the relationship begins, is with service. And this is where you're going to manage your clients inside the CRM system. You're going to have some automated communication. So like I mentioned before, you can send emails, text messages, and also if you prefer, you can upgrade and have a mail house automatically send out birthday cards, thank you cards, anniversary cards, Christmas cards, holiday cards, whatever you choose. We can set that up for automation. And then most importantly, this tracks the interactions that you have with your clients, delivering that extra support that you may not, your clients are not getting right now, but they are once they enroll with you. And then our contracting is completely integrated with the CRM system. So when you first onboard, or if you decide to add to one of the carriers that we mentioned before, the CRM system now has seamless onboarding. It's all paperless, and you can see exactly where you are in the process, making it very transparent on what the next steps are when you're onboarding. This is our Gold Key. Our Gold Key originally started out like a USB drive here, where we loaded up all these important and essential documents that we have digitized or we found online. So in the Medicare world, you have to have your summary of benefit, your directories, your sales videos, your flip charts. And what we were finding is you had to go and dive around in all these different websites to find this information. And if you did this on your own, between 30 different health plans, you would spend about 2 months trying to collect all this information. So what we do now is with HPM Shop, a lot of these documents are already preloaded and live inside of our quote and enroll tool. But we also have these important information such as updates, important phone numbers, enrollment instructions, the marketing guidelines. All of that is going to live inside of our Gold Key, which essentially is a cloud server which will be hooked up to your laptop, iPad, or your phone. So whichever device that you're using best, you can simply just jump on your phone and you go through the folders, you pick out what plan you're looking for, and all of these documents live right in there. So you have all of the information that you and your clients need at your fingertips. Customized marketing material. So like I said before, we put you front and center in your marketing. So things like business cards, posters, these are flyers. We plug in your phone number, pull-up banners. We put in your picture, your name, and your contact information when we design and develop these marketing tools. So we keep you front and center on all of the marketing. Doctor marketing. This is the central marketing hub of what we do. My background is in physician marketing. I understand what the doctors are looking for when building their practice. And one of the first things that you'll do when you join HPM is we're going to go through a marketing class with physicians. Most likely you'll meet with either myself or with Nick, and we will be talking about what you need to know in order to begin working with physicians and developing relationships. The first thing you have to know about doctor marketing is that you need a place to put your clients that you feel is going to protect your business. That's the main thing. Yes, they do have leads. Yes, it takes some time to develop that trusted relationship. So remember, they're trusting you to send their patients to enroll in their practice, keep them in their practice, and they also trust you to help them grow their practice by sending new patients. However, there are lots of doctor groups out there that are looking for sponsorships and true partnerships to help you grow your business as long as you help them grow theirs. These folks are hired to go out and represent the physician, and they go out and build relationships in the community. They set up events, and they look for locations, and they even go out there and look for leads. So as long as you've got these relationships which we can help you connect, you'll be able to get leads from these provider groups. Mobile Enrollment Center. So this is brand new for 2021. We brought in an RV. So our Mobile Enrollment Center, we affectionately call Stevie. Stevie is a way for you to get out into your local community, and no matter the weather, you'll be able to hop into the RV, and clients can get information about not only Medicare but ACA products right in their local community. As you may know, many seniors struggle with transportation issues, or it's too far away for them to meet at your office. We have the ability to set up basically a party on wheels where we can go into the 55 plus communities, the senior towers, or in other locations and events where we can get front and center into the community that needs health insurance. Direct deposit and direct pay. I love this right here because it looks like money's falling out of the sky on me here. I love this. When and if possible, we always have you get paid directly by the carrier. We have infrastructure to pay agents. However, it is not what I enjoy doing. I prefer to have the carriers pay you directly. So yes, we do have direct deposit. It goes right into your account, so there's no need to chase us down for a check. Some ACA carriers still require the agency to pay out commissions on behalf of the carrier to the agent, so we're happy to do that. And we do pay up to 3 times a month. That's actually a typo. It's not 3 times a week, but up to 3 times a month for your commissions on your book of business. So typically every 2 weeks you get a commission payment. As long as we've received the commissions, you'll get a payout. You'll see direct deposit on a Friday, and that previous Wednesday you'll get your statement, and so you'll know exactly what's going into the bank account on Friday. And lastly, one of the last tools and resources that we have, we're still building a couple new things here, but live today is our retirement program. This is also kind of like a life insurance policy for your book of business. So what would happen if you passed away today? Or what would happen if you decided that you truly wanted to retire? You didn't want to take your AHIP anymore, no more CE credits, no more licensing, no more trainings, no more classes. If you did that today, the carriers would keep those commissions that are coming to you. You need to stay licensed in order to continue to receive residual commissions. So we have created a program where is if you truly wanted to retire, or you did pass away and something happened to you, you can pass on your book of business to whoever you like, whether they're licensed or they're not. So we'll talk more about those details. But basically, if you wanted to retire, HPM would then pass your book of business down to you, and we have details on how that works. So reach out to us if you're interested in talking to us about our legacy program. But this is, like I said before, this is like a life insurance policy. Unfortunately, I've met and heard of agents that passed away unexpectedly and leaving their spouse without a book of business. Their income goes to nothing, and that's a sad thing, and that's the last thing that we want to have happen. And then also I've known of agents that had to work until 80, 85 years old until the end of their life just because they wanted to continue that commission stream, and it's not really a true retirement when you do that. So we're able to help you with that. All right, online you'll find some testimonials here, just a few here from Ramilda, Tanisha, Kelly, who was on the video there, and Larry Johnson. We do have agents that really do believe in our system, that have been successful, and we really do appreciate their partnership. And these are just a few of the successful agents that have made it with our partnership at Health Plan Markets. We're very grateful to have them on board, and we can't say enough great things about them. We truly feel like they're part of the team and not just an agent. All right, so this is one of my favorite slides. People ask me, hey Justin, how do I get to 6 figures, or how do I make a good living doing health insurance? And we live in such a great time for health insurance right now because of the ACA market and the Medicare market exploding. And the numbers that you see on the screen is really for Medicare here. there's still 10,000 people turning 65 every day. And that's still not going to slow down for a couple of years here. So at 10,000 people every day, no, you don't need 10,000 people to enroll in order to make a pretty decent living. You only need 349 clients. Now that 349 is based on the national commission rate for 2022 commissions. So if you live in markets like New Jersey or California, it's actually less clients in order to hit that six-figure income. But if you live in Puerto Rico, for instance, you've got a little bit more that you need because the commissions are less there. So at 349, that calculates to over $100,000 a year in annualized residual commission. So even if you stopped selling and you kept your book of business at 349 clients, for that year you'd still make six figures. Even if you went on vacation for 12 months, you were able to keep all your clients on your book of business, you'd still make six figures income on your book of business. So really, really great business, very lucrative business. And like I say, you guys are the highest paid customer service reps in the world because that's really, truly what we do. We do customer service. We service our clients and help them find health insurance, and we get paid really great to do so. So this is the timeline. We've always started our timeline here in April because this is really, after the enrollment periods when it starts to slow down and then we ramp back up. So I like to start in April here. In April, you should be doing your onboarding and contracting, getting those new carriers aligned and ready to go. In June, the carrier certifications and recertifications start to roll out. July is when we start talking about our marketing plans for the next year, and then we reset the clock. October 1st is when the Medicare pre-AEP begins. AEP begins on October 15th, and we are in go mode. ACA business typically starts in November, so if you're doing both markets, you're really, really busy from about September to January is when things really start to ramp up. December 8th is a mini lock-in there until January 1st, and then we begin OEP. We have January, February, and March to do our OEP, where you get that get out of jail for free card for Medicare. So you can make one last chance between those 3 months, and then lock-in begins on April 1st again. So that's our yearly timeline on the cycle of what we do for Medicare and helping advisors get to the next level. So where do we go from here? How do I become a Health Plan Markets benefit advisor? Well, we've got a CR code here, or QR code here, which seems to be a thing these days. You can go ahead and scan that, and that'll take you to joinhpm.com. You can call our office. If you're working with an agency partner and you need more information, just reach back out to them, and they'll be able to set you up, and we'll make it happen for you. The second step is you've got to get your online certifications and face-to-face trainings done. If you are coming in from another agency group, you'll need to have a release letter. Otherwise, we'll talk to you about the release structure and what we can do to get you beyond those older relationships and onto the next level. And then, of course, the last step is once you receive your RTS, you're ready to sell notifications. That's when we can begin talking about marketing and getting you out in front of the community. All right, well, that's all I have. I really hope that you guys enjoyed the presentation today. I thank you for taking time about learning more about Health Plan Markets, HPM, and we really, truly hope that you reach out to us, ask questions, and if you are interested, we'd love to have you part of the team. You can give us a call at 844-696-3975, or you can visit us at joinhpm.com. Thanks again for all of your time today. We really appreciate it, and we wish you the best of luck. Thank you, and take care.